Are you in pain?
Yes.
How long have you been in pain for?
Do you want me to start with the story of how it happened?
Sure.
Okay. In November of 2007, and I was driving, I live in Maine, and I was driving from Wiscasset, Maine to Augusta for work. And it was dark, it was raining, and I came up over the slope of a hill only to find a logging truck parked across both lanes of traffic. And with the cab pointing south and the trailer with a load of logs on it crossing the northbound lane. And by the time I saw it, because he was just below the crest of a hill, there was nothing I could do. And I slammed into him at about 35 miles an hour. I was very lucky because I slammed into him about 8 to 12 inches behind the hitch, which, if I had slammed into him at the hitch, both the car and I would have been decapitated. But that's not what happened. I was really lucky because I only shattered all the bones in both of my feet and ankles. And so they brought me to the hospital, and the first thing that the doctors said to both my husband Stuart and myself was that you need to be aware that you may never walk again, because both of my feet were so severely dislocated that, not to be too gross, but they were pointing in the wrong direction. And what they had to do is what they call, it sounds like such a nice word, they revised my ankles, which means essentially turning them so that they're pointing in the right direction. He said, this is going to be painful. Little did I know. And it was. And they brought me down to Maine Medical Center, which is in Portland, where I was very lucky to have a trauma therapist who, one of the things he does best is he puts things, usually children, puts things back together again. And what he did, in essence, was realize that the fractures were so great and there were so many of them that all he could do was put a metal plate over the breaks and essentially hold things in place so that they could heal as best as they could. Um, and he also realized that certain bones had been dislocated so badly that the likelihood that the bone would die and I would have severe arthritis was just about 100%. So I spent 3 days in the hospital, and then I went to the rehab center, and where I learned how to get around. I had casts on both of my legs so that I wasn't able to walk or anything for about 3 months, and pretty much learned to butt walk between the wheelchair and my bed and the commode. So that was life pretty much for about 3 months. And then I got the casts off, and the doctor told me I could learn to walk again. And that's when the pain really began.
Wow.
So
So, can you tell me a little bit about how bad the pain was and how it
um,
continued?
initially, it was interesting because um, the way the doctor explained it to me at one point when I was asking him, he said that the bottom of your foot is almost like graph paper, that there are all of the nerves and the wiring goes from your brain all the way down your body to the bottom of your feet, so that you have a sense, proprioception, that tells you where you are in space at any given time. And his guess is that my graph paper got really messed up, so that my balance became very off, and I couldn't really stand well. When I started learning to walk, that was when the pain really began, because the nerve endings were so sensitized, and everything was put together not where it was really supposed to be, that I would get incredible um, muscle spasms that would just, my muscles would just clench up. Or I would have what I always called sort of that the nerve endings, as they were coming back to life, would just all of a sudden shoot. So I would be sitting there doing nothing, and all of a sudden it would be like somebody just took a jolt, took like a hot iron and jabbed it into someplace in my foot. And so, and they told me, this is normal. This is just the process that everything goes through in reconnecting and rewiring itself, essentially. The other part that was sort of strange was initially my ankles didn't hurt, my toes hurt. That after spending so long in casts, the area, it was like the pad of your foot the pads of my feet were just, they had gone numb. And so that was like the worst part. So it's been over the 5 years, it's been a process of, first there was the really acute pain of sort of learning to walk again, getting used to my feet and knee sort of rewiring itself. And then it, over the years, moved into a more chronic kind of pain.
So, can you describe the difference between that acute pain and the chronic pain?
Um, it's funny because there really is a difference. This may sound really weird, but I sometimes think that the body can only deal with pain in like one area. So it's like I didn't notice the ankle pain because other parts of my feet were in such pain that I didn't notice it. The way I've likened it is both of my ankles feel like somebody took an elastic band and wrapped it around my ankles so that it's like really tight. So I feel like I have an elastic band between at the joint of the ankle, at that joint, so between where my foot is and where the rest of my leg is. But that didn't bother me because it was like the acute pain of the wiring and stuff. I wouldn't know when that was going to happen or when a muscle spasm was going to happen. So I think I was so attuned to that I just didn't pay attention to the rest.
Yeah.
But over the months, it took about 18 months for me to learn how to walk again and to really finish physical therapy. And so over the 18 months, those began to go away. I began walking more. My physical therapist would set goals for me where you're going to walk 500 steps, you're going to walk 700 steps, things like that. So that as I became more mobile, my body rewired. And so that stopped for the most part and the muscle spasms decreased.
Okay.
And so then I began to realize that my flexibility, there's something dorsiflexion, plantarflexion, eversion, and inversion. So it's whether your foot moves up or down, and going up and down and in and out. And that was compromised. So I had to do exercises. I mean, I would be on the toilet in a chair, in my wheelchair, and I'd be sitting there going up, down, up, down, up, down, in, out, in, out, in. Out. They were just never still. And I realized if I didn't do them, my feet sort of froze up really, really quickly. So that was when I began realizing that if I don't do things to keep myself mobile, I will lose my mobility really, really quickly. You have two choices. You can move and be in pain, or you cannot move and then not be able to move later on. So after 18 months, I did get a job, and I worked for about a year after that and realized that I couldn't work anymore because if I didn't get up and move, by the end of the day, I was the social worker for the Alzheimer's Association. And so by the end of the day, I would get up to leave the office and go back to my car, and I could hardly move.
Wow.
It was like those first steps were just, and I don't know if other people have said, I'm very sensitive about not letting people know that I'm in pain. I just do not want people to know that. but I would get up and grab my crutches, and it would just be like holding my breath until I could just take the first couple of steps so that I could get things moving.
Wow.
Yeah. What I have found is the most helpful for me is going to a therapy pool. And I try to do that religiously 3 times a week. Because the pool is the one place I can walk without assistance, and I can really walk the way people are supposed to walk. What's happened over time is that my left foot in particular has it's collapsing so that it is now about 26% tilted to the outside. So I have a real tendency to walk on the outside of my foot, which means that I change my gait, which impacts my knees, which impacts my back and everything else. So that what I find is going to the pool and spending an hour each time walking at a true gait so that I can keep myself reminded this is how you're supposed to walk. So that when I'm out in the world, I try and wearing my shoes and stuff, I try to do my best to walk the way you're supposed to walk. I tried taking pain medication, but I'm very sensitive to any kind of pain medication. And what would happen is it would just zonk me out so that I was really not able to function. But I have a great doctor who I adore, and she has let me try a variety of different things. Quite honestly, the only thing I haven't tried is acupuncture, and part of the reason why I haven't tried that is I hate needles. I had to have so many shots and be on IVs so many times that I just don't love needles.
So
Um,
finding the pool therapy working was after a long journey of trying a lot of other things that didn't help.
exactly. Or just finding things. It's not that they didn't help, they didn't fit with the life that I wanted to have. If I take most of the pain medications, tramadol, um, other kinds of opiates, anything like that, it makes me so tired and so foggy that I just can't enjoy things. I have to worry about my driving, all of that. So it's just, for me, it's just finding a balance. And if there are days when I'm in more pain than other days, then I have to be patient with myself and just say, you don't have to do everything today. If I can't walk the dogs, then I can't walk the dogs. And I have to ask Stuart to do it, much as I absolutely hate doing that. Um, yeah. And exercise does not come naturally to me at all. I do not come from a family of people who exercise. So that for me to go to not only to the pool, but to our local gym has a seated elliptical machine, which is really good for me. And they also have all the weight machines and stuff like that. And I hate doing it. But I know that, once again, it's a balance. If I don't do it, I will be sorry. So
Yeah.
that's, it's sort of, you can feel resentful of the pain, but it's not going away. So if you don't be friends with it, or accept it.
So can you talk a little bit about that acceptance of pain? I know you've been to a psychiatrist, you said. Do you want to talk about how you've come to accept it?
Yeah. Well, my background is I'm a social worker, and I certainly have dealt with people who have had traumatic events in their life before. When I was in the rehab center after the accident, um, I was lucky to be visited by a really good psychologist. And he talked to me about the accident and encouraged me to really speak about it in great detail, what I remembered, the sight, the sound, the smells, absolutely everything that I remembered. And when I was leaving rehab, I was there for about 2 weeks. He gave me the name of a trauma therapist who was great, and he actually came to the house. I met with me for probably, I think I met with him for probably about 6 months. Um, And again, just really issues of desensitizing. By that time, I was beginning to go out into the world, and I found that I was really sensitized to like ambulance noises, to when I saw a logging truck on the road. I mean, there were a variety of things. Big trucks. I still don't like big trucks. Um, and even though logic tells me this was one of those accidents that really comes out of nowhere, who would dream that a logging truck would be blocking both lanes of traffic? So that the trauma therapist really helped me deal with the reality, of the accident and that it was an accident. So periodically, if I'm having a bad time, I'll go back to the trauma therapist for a tune-up, and that helps.
Yeah. Um, and so I'm curious. I know just pain, having pain every day just affects every aspect of your life, and I'm wondering if you can kind of talk about the reality of really living with pain and what's hard and what's impossible and what you have to go through.
What's hard, it's exhausting. It's really tiring, and I, as I said before, I really hate admitting it. I mean, most people would not know that I'm in pain all the time, and don't you dare tell anybody. So, um, so it's just really tiring, and your life becomes, or certainly my life becomes, um, a sort of a balancing act of, is doing what I need to do worth the pain that I'm going to go through? And the answer always has to be yes, because I can't start giving things up. So that it's, again, I know the mornings are better for me. So if I'm going to walk the dogs, I really should probably do it, in late morning, early afternoon. Um, if I'm going to do one thing during the day, don't do anything else. Uh, every part of my life is subject to what I should do in order to keep my feet as flexible as possible and minimize the pain that I'm in. And the hard part for me is I'm not very good at living my life that way. When I drive over to Vermont, which is 3 hours, I should not sit in one position for 3 hours. That's stupid. Do I really want to get out of the car and, do exercises and stretches and stuff like that? No. And I usually don't, and I pay for it. So it's, every aspect of life becomes subject to what do I need to do to either avoid being in pain, or, as a friend of mine once put it, put on your big girl pants and just go do it. So even if I don't want to go walk the dogs, I have to go walk the dogs. It's my responsibility, and I can't give up doing the things I'm responsible for.
And on a daily basis, what would you say your pain level is?
Depends upon the day. There are days that are good days, and I would say a good day. I actually hate those pain scales.
I know.
I think they're the stupidest things ever created, because my idea of a 10 pain, which is like through the roof, and I just want to, put a knife in my heart. I have a feeling that would probably be, I have a very high pain threshold, people have told me. So I don't think my 10 is somebody else's 10. So I don't know how to, on a day that's good, I will feel like I can do a variety of things. I will not use the wheelchair in the morning. I will start out with my crutches right off. I'll take the dogs. On a good day, I can walk the dogs up to 3/4 of a mile on my crutches. I will be a mess after that, but I can do that. And so on a good day, I just maximize. But I don't think I can tell you, on a bad day, I just don't do as much.